In this changing world, parents are choosing not to vaccinate their children against diseases that have infected or even killed many people in this world. Parents have information that has misled them into this decision. I'm going to talk about why we need to vaccinate, why is it safe to receive vaccinations, and is there a link between autism and vaccines? Many parents ask, why should we keep vaccinating against diseases that we will probably never see? A very legitimate question. And according to the CDC, when it comes to vaccines, the more people who are vaccinated, the fewer opportunities a disease has to spread. If or when one or two cases of the disease are introduced into a community where most of the people are not vaccinated, an outbreak will occur. When the rate of people vaccinated drops to low levels nationally, diseases could become as common as they were before the vaccine was even invented. Are vaccines safe? We want to keep our children safe. We want to make sure the care they're getting is keeping them safe. Vaccines have saved 2.5 million children from preventable diseases every year. The CDC estimates that immunizations prevent about 419 million illnesses, 26.8 million hospitalizations, and 936,000 early deaths of children born between 1994 and 2018. Ingredients in vaccines are safe in the amount that are used in them. Most vaccines are made from a weakened form of the disease it is designed to protect you from. Your body will then create the antibodies it needs to destroy the disease and make it so that you never get it again. Most people think that mercury is in vaccines, but it was taken out of most of them in 1999. There are only trace amounts in the vaccine, and you will get more mercury in your body from eating one tuna fish. Tuna fish contains 28 micrograms of mercury. That is 9 times more than the typical infant gets from all of their vaccines combined. People are also concerned about getting a reaction from it. This is very rare. The most common side effect of vaccines is anaphylactics, which is a severe allergic reaction. This occurs 1 per several 100,000 to 1 per million vaccines. That means you are 100 times more likely to be struck by lightning than have a severe allergic reaction. The big debate that vaccines cause autism. The controversy started in 1998 when The Lancet, a British medical journal, published a false study saying a possible link between autism and measles vaccines was found. In 2010, The Lancet was forced to retract that study after the British medical panel found its main author, Dr. Andrew Wakefield, guilty of gross misconduct. Dr. Wakefield was being paid by a law firm that was suing the manufacturer of a measles vaccine. In the article called Fast Facts Measles Comeback, I found that in the year 2000, measles in the U.S. was considered eradicated because the U.S. went 12 months without transmission of the disease. Unfortunately, since then, vaccination rates have gone down. Just because two things occur one after another does not mean one caused the other. Human nature is that if something happens, we always look to what immediately precedes it. The great vaccine debate will continue. As a healthcare worker, my job is to educate my patients so they know the truth. Vaccines causing autism is a myth. Vaccines have been proven to be safe and still important even though we are vaccinating against diseases we may never see. With the rate of unvaccinated children growing, we could be looking at a disease epidemic in the future.